let's have this discussion now. So 40% of males in Gauteng were treated for male urethritis syndrome, which detected STIs between April and December 2023. This is according to the Gauteng Health Department, which raised concerns over the alarming rise in STIs in the province. The department said it has noted an increase in STIs in areas such as Alexandra, Sandton, Braamfontein and Hillbrow. With today being International Condom Day, let's get reaction on these numbers from the Treatment Action Campaign's chairperson, Mr. Monwabisi Mbasa. Mr. Mbasa, good morning to you. Thank you so much for joining us. 40% of males in Gauteng. This is a staggering number. I mean, your first reaction to hearing those, were you surprised by those numbers?
Actually, we were shocked but not surprised because it is something that we anticipated. In the province of Gauteng, we've been having a serious problem of condom shortages for a period of close to 5 years. So surely if you are not going to have condoms, you were likely to have such numbers. So it's something that took us aback. We are very concerned about this, and we will continue to engage government to ensure that they provide condoms in order to be able to circumvent this calamity not to go further.
I think it's one thing to talk about the condom shortage in the province of Gauteng, but this is a very specific sort of look at which areas of the province. Alexandra, Sandton, Braamfontein and Hillbrow. Let's talk about why those particular areas would be such hotspots.
The reality is that, men are still difficult to be found, or rather to go to the clinics or maybe primary health care. So you find that, generally men are people who are sort of, refraining from going to the facilities to go and screen or even test for STIs, including HIV. So that must be concerning. You are quite correct. I agree with you. But the Treatment Action Campaign, we have noted some of the structural problems that makes men in particular not to visit clinics based on the issues that continues to plague the primary healthcare system. I don't know if maybe I can continue to give you the examples.
Sure, go ahead. We'd love to hear them.
Okay, so men generally are people that do not want to stay longer in the clinic. And the majority of our clinics, due to the shortage of staff, the long waiting times are quite staggering. And also the shortage of male nurses. In fact, the scarcity of male nurses. Men do not have confidence in women, especially where they have to sort of reveal or undress in front of women. And that for them, it makes them to stay away from the healthcare facilities. Issues of bad staff attitude are some of the issues that makes men to actually be reluctant from going to the healthcare facilities. So those are the fundamental structural problems that men in particular are actually resistant to go to the facilities. If we can address that, probably this number will be reduced because much more men will now go to the healthcare facilities without any problem. Yeah,
I'm wondering if 40% of men in Gauteng were treated for male urethritis syndrome. 40%, what does that number then look like for women? Mr. Mbasa, if you were to compare those numbers. And then, of course, maybe just educate us so that people that are watching are able to actually know what urethritis syndrome actually is.
Oh, okay. So this is a syndrome which is associated with STIs, and also, it is associated with HIV because STIs are linked with HIV. So when people are engaging in unprotected sex, are likely to actually, get infected to this particular syndrome. So this is a very serious syndrome, which as a country, we need to take it very, very serious. And sometimes STIs, generally as a population, are things that we are normally in our blind spot, are not in the core concern when it comes to health, and are quite serious because can be extremely, dangerous, can even be fatal to a certain degree. So this is quite serious. So this is a dangerous, syndrome that requires attention.
Yeah, I think it's interesting that you've got these new innovations that are, have been around for a few years, though, but essentially really trying to help us deal with the spread of STIs and STDs. You've got the likes of PrEP, right, the pre-exposure prophylaxis, and that has apparently seen an increase in its use in Gauteng, but that has led to riskier behavior. That's concerning. So people are using PrEP as a way of dealing with, protect themselves after having engaged in risky behavior.
Yeah, no, you're quite correct, and we are trying to push a treatment action campaign that at least everybody must have access to pre-exposure prophylaxis and post-exposure prophylaxis. But let me just highlight something regarding that. So pre-exposure prophylaxis does not protect you against STIs. It is the external and female condoms that can be able to protect you from STIs. They only prevent HIV, but they do not prevent STIs and STDs. So what we're encouraging now is that when people are engaging on sexual intercourse, they should at least use pre-exposure prophylaxis together with condoms for maximum protection. Because at times, if the condom bursts, but at least you know that PrEP will be able to shield you. But PrEP alone does not sort of protect you against STIs. And we're also condemning the risk behavior. If you look at Gauteng in particular, in the context of this particular discussion, is that, I mean, we are looking at this province, the type of life that, majority of people are living, especially when it comes to weekends and all of that. So you realize that people are much more exposed to risk behaviors, or the risk behaviors leads them to issues like, contracting HIV, including the STIs. Therefore, that's why we're making a call and doing this community awareness programs to ensure that at least people are aware of what type of life that they should lead, at the same time to be able to protect themselves every time they are engaged in sexual intercourse.
Yeah, some of the numbers here is quite scary. Close to 40,000 females aged between 15 to 49 years were initiated on PrEP, but the department saying that those who have gone, and that compares to about 11,000 males, and the department concerned that those who are using PrEP are not also backing themselves up, and studies have reported that STI incidence is high among young women receiving PrEP. So you talked a little bit about that shortage in condoms in Gauteng. Who do we hold accountable for that, and how do we ensure that we change that?
Okay. Here in this regard, it is government, because the government carries the responsibility of supplying condoms. Although we do have condoms that are being sold over the counter. But as you would be aware that majority of people are unemployed, at times might want to engage into sexual intercourse, but might not have money to purchase condoms. So government carries that responsibility to ensure that condoms are being supplied and are easily accessible. So now we've been having a serious problem of shortage of condoms, especially in the province of Gauteng, due to technical issues in terms of supply chain management and all of that. So that creates a serious problem. So the government is the one that needs to be held accountable. As treatment action campaign being part of the Gauteng AIDS Council, we've been holding the premier accountable. They've been making promises that they will purchase condoms. So we'll be going to another Gauteng AIDS Council very soon. So we're going to follow that particular commitment to check if is there anything that has been done or not. But this is a serious crisis. Yeah,
well, we'll leave it there. Mr. Monwabisi Mbasa there, Gauteng chairperson of the Treatment Action Campaign. And that's the message coming from the Gauteng Department of Health. With Valentine's Day around the corner, they're encouraging us to, of course, exercise safe sexual behavior with those really frightening numbers of STI diagnoses in the province.